Majority Floor Leader.
Mr. President, I move that we proceed with additional reference of business.
Secretary is so directed.
Additional reference of business. Message from the House of Representatives. Letter from the House informing the Senate that on 30 July 2024, it passed the following House bills in which it requests the concurrence of the Senate. House number 10396, separating the Bocong National High School, Tabac Annex, Upper Pulacan, Labangan, Zamboanga del Sur, from Bocong National High School, converting it into an independent national high school to be known as the Tabac National High School, appropriating funds therefore. And House number 10397, converting the Calateo Elementary School in Calateo, Huban, Sorsogon into the Calateo Integrated School, appropriating funds therefore. House number 10440, establishing a national high school in Poblacion East, Santa Ignacia, Tarlac, to be known as the Santa Ignacia National High School, appropriating funds therefore. 10441, establishing a national high school in Manikling, San Isidro, Davao Oriental, to be known as the Manikling National High School, appropriating funds therefore. 10442, establishing a national high school in Maputi, Banay-Banay, Davao Oriental, to be known as the Maputi National High School, appropriating funds therefore. And House number 10443, separating the Liloy National High School, Silukap Extension, in Liloy, Zamboanga del Norte, from the Liloy National High School, converting it into the Silukap National High School, appropriating funds therefore. Basic Education.
To the Committees on Basic Education and Finance.
House number 10404, establishing a TESTA Training and Assessment Center in Calamba, Laguna, appropriating funds therefore.
To the Committees on Higher Technical Vocational Education and Finance.
10405, establishing a state college in the Lone District of the province of Dinagat Islands, appropriating funds therefore.
To the Committees on Higher Technical Vocational Education, Ways and Means and Finance.
10406, converting the satellite campus of the Laguna State Polytechnic University in Lopez, Quezon into a regular campus, appropriating funds therefore. 10407, converting the Cavite campus of the Eulogio Amang Rodriguez Institute of Science and Technology in General Mariano Alvarez into a regular campus, appropriating funds therefore. 10408, converting the extension campus of the Cebu Normal University in Medellin, Cebu into a regular campus, appropriating funds therefore. 10409, converting the extension campuses of the Cebu Technological University in Tabagon, Tabuelan, Bantayan, and San Remigio, Cebu into regular campuses, appropriating funds therefore. 10410, converting the Medina Satellite Campus of the Bukidnon State University in Medina, Misamis Oriental into a regular campus, appropriating funds therefore.
To the Committees on Higher Technical Vocational Education and Finance.
10411, converting the Satellite Campus of the Bukidnon State University in Talisayan, Misamis Oriental into a regular campus, appropriating funds therefore. Higher Education.
To the Committees on Higher Technical Vocational Education and Finance.
10446, converting the Davao del Sur State College in Digos, Davao del Sur into a state university, appropriating funds therefore.
To the Committees on Higher Technical Vocational Education, Ways and Means and Finance.
10447, converting the extension campuses of the Cavite State University in the municipality of Carmona and Silang, province of Cavite into regular campuses, appropriating funds therefore.
To the Committees on Higher Technical Vocational Education and Finance.
10418, increasing the bed capacity of the Wao District Hospital, Wao, Lanao del Sur, from 25 to 100 beds, appropriating funds therefore. 10444, establishing in the Calamba, Laguna, a general hospital to be known as the Calamba City General Hospital, appropriating funds therefore. 10445, increasing the bed capacity of the Tomas La Chica District Hospital in Jose Abad Santos, Davao Occidental, from 25 to 50 beds, appropriating funds therefore. And House number 10472, increasing the bed capacity of the Southern Tagalog Regional Hospital in Bacoor, Cavite from 100 to 300 beds, appropriating funds therefore.
To the Committees on Health, Demography, and Finance.
House number 102, providing for affordable funeral services to indigents, appropriating funds therefore.
To the Committees on Social Justice, Welfare and Rural Development, Trade, Commerce, and Entrepreneurship, and Finance.
9873, an act to declare December of every year as National Volunteer Month in the entire country, amending for the purpose RA 9418, otherwise known as the Volunteer Act of 2007.
To the Committee on Social Justice, Welfare and Rural Development.
10289, mandating and institutionalizing a rollover data allocation scheme and providing penalties for non-compliance therewith.
To the Committee on Public Service.
10422, strengthening the Philippine Disaster Risk Reduction and Management System, amending for the purpose RA 10121, otherwise known as the Philippine Disaster Risk Reduction and Management Act of 2010.
To the Committees on National Defense and Security, Peace, Unification and Reconciliation, and Finance.
10466, adjusting the monthly pension benefits of retirees of the DFA.
To the Committees on Government Corporations and Public Enterprises, Civil Service, Government Reorganization, and Professional Regulation and Finance.
House Number 10424, regulating the operation of motorcycles for hire and providing penalties for violation thereof.
To the Committee on Public Services.
10439, providing right of access to medical cannabis, establishing the Medical Cannabis Office and providing funds therefor.
To the Committees on Health and Demography, Public Order, and Dangerous Drugs and Finance.
Letter from the House informing the Senate that on 29 July 2024, it reconsidered the ratification of the Conference Committee report on the disagreeing provisions of House Number 9284, House Number 3917, and Senate Number 2432.
To the Committee on Rules.
Letter from the House informing the Senate that on 29 July 2024, it designated Representatives Arnverga, Swansing Jr., Nograles, Estrella, Emano, Plaza, Singson, Mihan, Kimbo, Acheron, Briones, and Lee as conferees of the Conference Committee on the disagreeing provisions of House Number 9284, House Number 3917, and Senate Number 2432.
To the Committee on Rules.
Second edition.
Wala pa. Second additional reference of business, message from the House, letter from the House informing the Senate that on 29 July 2024, it reconsidered the ratification of the Conference Committee report on the disagreeing provisions of House Number 7325, Magna Carta of Filipino Seafarers, and Senate Number 2221, providing for the Magna Carta of Filipino Seafarers.
To the Archives.
Letter from the House informing the Senate that on 29 July 2024, it designated Representatives Asidre, Primicias Agabas, Gonzales, Salo, and Magsino as conferees of the Bicameral Conference Committee on the disagreeing provisions of House Number 7325, Magna Carta of Filipino Seafarers, and Senate Number 2221, Magna Carta of Filipino Seafarers.
To the Archives.
Letter from the House informing the Senate that on 30 July 2024, it concurred with the Senate amendments to the following House bills. House Number 6579, 5 additional branches of the RTC in the National Capital Judicial Region to be stationed in the city of Muntinlupa. House Number 6581, creating 3 additional branches of the Metropolitan Trial Court in the National Capital Judicial Region to be stationed in the city of Parañaque. House Number 6582, creating 2 additional branches of the RTC in the 2nd Judicial Region to be stationed in Cabagan, Isabela. House Number 6583, creating 3 additional branches of the RTC in the 10th Judicial Region to be stationed in San Jose, Dinagat Islands, and 2 additional MTC in the 10th Judicial Region to be stationed in San Jose, Basilisa, Dinagat Islands. 6584, 1 additional branch of the RTC to be designated a special court for drugs cases in the 8th Judicial Region to be stationed in Baybay, Leyte. 6585, creating 6 additional branches of the RTC in the 9th Judicial Region, Diplahan, Zamboanga, Sibugay. 6586, 3 additional branches of the RTC in the 10th Judicial Region, City of Valencia, Province of Bukidnon. 6587, 4 additional branches of the RTC in the 8th Judicial Region in Tacloban, Leyte. 6588, 12 additional branches of the RTC in the 4th Judicial Region to be stationed in Los Baños and City of Cabuyao, Laguna. 1 additional branch of the MTCC in the 4th Judicial Region in Cabuyao, Laguna. 8247, creating 4 additional branches of the RTC in the 4th Judicial Region to be stationed in Calawag, Quezon. 8248, 2 additional branches of the RTC and 2 additional branches of the MTCC in the 9th Judicial Region in Pagadian, Zamboanga del Sur. House Number 8249, 10 additional branches of the RTC and 8 additional branches of the MTCC in the 4th Judicial Region, Antipolo, Province of Rizal. 8250, 2 additional branches of the RTC in the 11th Judicial Region, Island Garden, City of Samal, and City of Panabo, Davao del Norte. 8251, 4 additional branches of the RTC and 4 additional branches of the MTCC 8th Judicial Region, City of Ormoc, Leyte. 8252, 2 additional branches of the RTC in the 12th Judicial Region to be stationed in Tubod, Lanao del Norte. 8253, creating 1 additional branch of the MTCC in the 10th Judicial Region in Malaybalay, Bukidnon. 8255, 2 additional branches of the MTCC in the 6th Judicial Region in Bacolod, Negros Occidental. 8256, 3 additional branches of the RTC and 2 additional branches of the MTC in the National Capital Judicial Region to be stationed in Navotas. 8258, 3 additional branches of the MTCC in the 1st Judicial Region in San Carlos, Pangasinan. 8259, additional branches of the RTC and Metropolitan Trial Court in the National Capital Judicial Region to be stationed in the city of San Juan, converting 4 branches of the RTC in Pasig City into 4 branches of the RTC in the city of San Juan. 8260, creating 2 additional branches of the RTC in the 10th Judicial Region in Gingoog, Misamis Oriental. Archives.
To the archives. Session is suspended. Majority Floor Leader.
Mr. President, with the consent of the body, I move that we resume consideration of House Bills numbers 8426, 8483, 9335, 9623, 9624, 8484, 8491, 8492, 8494, 8970, and 9556. These are all hospital bills. I so move, Mr. President.
Is there any objection? Chair hears none. Same is approved. Majority Leader.
Mr. President, the parliamentary status of the bills is that we have sponsored the measures with the consent of the body. I move to have an omnibus interpellation on all the measures, considering that the interpellations of Senator Aquilino Cocopimentel are applicable to all the aforementioned bills. So I so move, Mr. President.
Up to saan ka nag-start dito? 96, 95.
Is there any objection? Chair hears none. The motion of the Majority Leader is approved.
Mr. President, I move to recognize the sponsor, Senator Christopher Lawrence Bongo, and to interpellate our minority leader, Senator Aquilino Cocopimentel. I so move, Mr. President.
Senator Bongo, the sponsor of the aforementioned measures, as well as our Minority Leader, are recognized. The gentlemen have the floor. May amendment si Bong.
So, Mr. President, we are now tackling around, let me count the number of bills, Mr. President.
Eleven.
Well, which one? I count 13 on my draft. Ano tawag mo to? Agenda. So which ones are we not? Which ones are we not discussing? Which House bill?
Yes. Medyo nasa agenda ba lahat?
Minus Zamboanga and Lucena, Your Honor.
Can we mention the House bill number, please? Sambong. If we can have a minute suspension, Mr. President.
Session suspended.
Thank you. With the permission of our sponsor, Mr. President. Basically, this is just to educate this representation, Mr. President, on why we need to legislate on increasing bed capacities of hospital, Mr. President. So, for example, House Bill number 8426 under Committee Report 268. This upgrades now the Bataan General Hospital Medical Center in the city of Balanga, province of Bataan, to a multi-specialty hospital and increasing its bed capacity from 500 to 1,000 beds and appropriating funds therefore. So dalawang ideas po ang nandito sa House Bill na to as expressed in the title. So it's already a general hospital. And we are upgrading it to a multi-specialty hospital. What would be the practical difference, Mr. President, between a multi-specialty hospital and a general hospital?
Yung Basila, no?
Bataan. Specialty.
Mr. President, we need to pass laws because we need to repeal or amend existing laws providing for the upgrade of the DOH hospital. For this instance, Mr. President, we are passing laws for the following hospitals: the Basilan General Hospital. The hospital has not received an upgrade since Republic Act 8543 in 1998. Bataan General Hospital Medical Center, the hospital has not received an upgrade since 2019, since Republic Act 11107 in 2019, Mr. President. For Bataan, Mr. President, they plan to have a cancer center. Kaya may specialty po ito, specialty center, Mr. President.
I think, with the permission of the gentleman who have the floor, all of these local hospitals, Your Honor, were established by law, and these laws indicated how many beds the hospital would be at the time they were established. So whenever we increase the bed capacity when it was originally established, there is a need to so amend the law to reflect the new bed capacity. I completely disagree, Mr. President, Your Honor, why this indeed has to be done. Perhaps the sponsor can consider later on an amendment that will say increase the bed capacity and then say which may be increased upon the approval or subject to the approval of the Department of Health. But in no case to exceed X beds, for example. Para hindi na po sila balik ng balik sa atin, kada gagawing 50 yung 20, kada gagawing 75 yung 50, kada gagawing 100 yung 75. We were able to do something like that for the state universities and colleges. Perhaps the committee can find a way as well to ease the burden of both the House and the Senate in regard to these requests.
Mr. President, kung ako lang po masusunod, gusto po nating taasan ng bed capacity ng lahat ng DOH hospitals. Pero kailangan pag-aralan ng DOH ng mabuti base po sa yung karanasan natin sa pandemya, no? Ang totoong bed capacity rate ng DOH hospitals kapag may health crisis, kung ano ho bang appropriate bed capacity. But meron tayong na-file din po no na bill, no? Yung DOH bed capacity. Saan yan? Akin na.
And it may not be as easy as that, Mr. President. Kaya nga, this interpellation will wants to bring out all of these concepts. Actually, itong ating mga bills na pinag-usapan na ito, okay, halo-halo ang concepts dito. Number one, there are bills establishing a general hospital in a certain place. So yun yung step one na sinabi ng Senate President natin kanina. That's why when we rename or when we upgrade, we have to amend the law because a law established a general hospital. And then meron ang ibang bills dito upgrades an already established general hospital to a multi-specialty hospital. Ang iba naman levels from a level 1 to a level 2 or from a level 2 to a level 3. That is part of the bill. And then a lot of bills now also increase the bed capacity. So parang pangatlong concept lang po yung bed capacity dito po sa mga bills natin. Okay. In the establishment of a general hospital in a certain place, is that considered a national hospital or a nationally administered hospital through the DOH?
Pag DOH hospital po, Mr. President.
For example, let's be very specific. The Bataan General Hospital and Medical Center in the city of Balanga, province of Bataan, was this originally established by law?
Yes, Mr. President.
And then, who spends for it?
DOH po. Pag itong Balanga sa Bataan,
Yes.
DOH hospital po ito.
So it's found in the in the GAA under the budget of the DOH.
Yes, Mr. President.
Is it as a line item?
Meron po, Mr.
Line
President.
item, makikita po natin when we look at the GAA,
Yes, Mr.
andun si
President.
Bataan General Hospital and Medical Center, and then nandun yung amount niya.
Yes.
Correct,
Okay.
Mr. President.
Okay, so, it is now a general hospital. Our bill wants to upgrade it into a multi-specialty hospital, and according to our sponsor, because it is now considered multi-specialty because they will add a cancer
Cancer
center.
center.
Cancer center. So parang,
Batas tayo, existing law tayo, di ba? Paano yung existing law natin yung sa regional specialty? Kailangan pa ito ilagay.
so we will just be adding one specialty, cancer. Ganun po yun. You're originally a general hospital, not known to be specializing in a certain disease or illness, and now Bataan General Hospital wants to be known as a cancer specialist hospital. Ganun po ba yun?
Correct, Mr.
Yeah.
President. Dagdag lang po itong multi-specialty Apex Hospital. Gusto
Hindi,
nila
doon ako sa multi naka-focus eh. Ano sabihin ng multi-specialty? So, aside from cancer, meron pa siyang ibang specialties?
Possible, Mr. President. Halimbawa, gusto nila maglagay ng cardiovascular care, heart care,
Okay.
cancer care, orthopedic, mental health, neonatal para sa babies.
Pwede.
Pwede rin po,
Okay.
brain and spine. At meron tayong batas rin po, Mr. President, na institutionalize natin. Ito pong 9 Republic 91159. Ito pong 11959, ito pong Regional Specialty Centers Act na ipinasa po natin ngayong 19th Congress. It's a multi-year plan of the government na kung saan po ay maglalagay ng mga specialty centers sa mga existing DOH hospitals. Halimbawa po sa Davao, SPMC, lalagay na po sila doon ng heart center. Hindi po ito stand-alone, but sa mga selected DOH hospitals across the country. Halimbawa, sa Tacloban, plano nilang lagyan po sa loob ng 5 taon ng cardiovascular care o heart center para yung mga kababayan natin na hindi na po kailangan pumunta ng heart center para sa pagpapagamot. Sa Zamboanga, maglalagay na rin po sila. Sa Cagayan de Oro, sa lugar mo po, Mr. President, maglalagay na rin po doon ng cardiovascular care o heart center. So ito po yung mga nasa existing DOH hospitals, paglalagyan po ng mga specialty center. About 17 of them po, ito kasama na dito yung ortho sa buto, brain and spine, lung, neonatal, geriatric. Ito po, yung panukalang batas rin po na gusto mong magkaroon ng sariling geriatric center po dito sa National Capital Region. Pero pwede na po itong ilagay rin po sa mga existing DOH hospitals through the Regional Specialty Centers Act, Mr. President.
So, Mr. President, focusing specifically on House Bill number 8426, anyway, ma-influence naman itong yung interpellation sa ibang bills. But what's the essence of this bill? Is it the upgrading of the Bataan General Hospital to a multi-specialty hospital, or is it in the increase in the bed capacity from 500 to 1,000? Kasi from the answer, parang hindi ba nagpasa na nga tayo nung bill just recently, Mr. President, yung sa specialty hospitals. At saka, if you look at the definition of a DOH hospital or the guidelines of the DOH on the DOH hospital goal, ang sabi rito, towards apex provider with specialty care services with subnational or regional catchment. So, hindi ba empowered na po sila to pursue all of those specialty care abilities or capacities that they want to provide as a general hospital? Hindi na sila kailangan gawin by law, declared by law as a multi-specialty hospital?
Actually, Mr. President, it's both, no? This bill is in line with the Republic Act 11959 or the Regional Specialty Centers Act. Gusto lang siguro masiguro sa bill that they will have a specialty centers. Along with it, the service capability of the hospital will be created. Ang plano po nila to upgrade the hospital beds from 500 to 1,000 beds. No? The hospital's average bed capacity is 100%, which is above the target of 85%. The hospital has not received an upgrade since 2019. According to the DOH, the gap for level 3 hospital beds in Region 3 is 5,349 beds. That's why the DOH fully supports its passage, and the DBM has no objections. At gusto ko lang po isingit, Mr. President, an initial budget was included already in the 2024 GAA amounting to 180 million, Mr. President.
180 million is the total budget for the Bataan General Hospital.
Correct, Mr. President. It was already included in the 2024 GAA.
And so i-compare natin siya sa kanyang last budget. Kasi siguro, is the sponsor pointing this out to tell us that we already anticipated its upgrade, kaya 180 million pesos na yung kanyang budget? Ganun po ba yun?
Dinagdagan na po nila sa Congress, no, sa lower house,
Opo.
ng 180 million in anticipation of its passage, Mr. President. Actually, I think last year pa po ito na i-file po itong bill or pumasa na po ito sa lower house.
That's why I want to be clarified. Yung 180 million pesos, dagdag ba yun or is that the total budget for the Bataan General Hospital and Medical
Dagdag po, additional po ito.
Dagdag, kaya nga, okay. So, meaning to say na ang budgetary implication of upgrading the Bataan General Hospital and Medical Center to a multi-specialty hospital and increasing its bed capacity from 500 to 1,000 beds is around 180 million pesos.
Initial lang po, Mr. President.
Initial lang. So paano po ba yan? Paano po ang projected budgetary implication? And why can we afford to give it in tranches, Mr. President?
Ang budget po ng Bataan General Hospital, kailangan nila for capital outlay is 3 billion. Ang kanilang MOOE, 703 million. Ang personal services, 823 million, Mr. President. Yun po ang kanilang kailangan para maging multi-specialty hospital, Mr. President.
So when we convert or upgrade a general hospital into a multi-specialty hospital, which item of the budget is affected? PS, MOE, or CO?
Lahat na po, Mr. President.
Lahat. Okay. When we increase the bed capacity, which item of the budget is affected?
Lahat rin po, Mr. President.
Okay.
Mag-a-add ng personnel, kailangan nila ng additional ng MOOE at capital outlay, Mr. President.
Yung stated bed capacity po ba ng isang hospital under the law, is that only a legal concept or is that the reality that the hospital really, kunyari itong Bataan General Hospital and Medical Center, talagang hanggang 500 beds lang ang linalagay nila sa hospital? Sa tunay na buhay.
Yun lang po ang authorized.
Pero sa tunay na buhay, pag bibilangin natin ang kama doon, hanggang 500 lang talaga?
Minsan, alam mo, sa kaikot ko sa buong Pilipinas, Mr. President, nakikita natin minsan sa koridor na yung mga pasyente. Sa labas ng corridor, isang kama, dalawang pasyente nagdidikit. Paano gagaling yung mga pasyente kung gano'n ang kinakatayuan nila? That's why it's badly needed po itong upgrading. And I'm sure nag-a-adjust po itong mga hospitals. Kahit na 500 lang yung capacity nila, hindi mo pwedeng tanggihan yung pasyente na lalampas ng 500 yung kapasidad nila. Kailangan nilang i-admit rin po yun. Bawal namang hindi nilang tanggapin dahil sa kakulangan ng kanilang pasilidad, Mr. President. That's why it's badly needed po itong upgrading.
So, ang practical implication nito, on paper, you are a 500-bed capacity hospital. That's why you're given a budget accordingly to computed at the 500-bed capacity. But in reality, at any given time, that 500-bed capacity hospital cares for more than 500 people.
Yes.
Tama po ba yun?
Correct, Mr. President. That's the reality right now, Mr. President.
Okay, can we get some specific information dito sa specific hospital na pinag-uusapan natin? Kunyari, right now, ilan ang pasyenteng tawag dyan? Inpatient, no? Confined. Ilan ang pasyenteng confined sa Bataan General Hospital and Medical Center who use up bed space? Ayan na, para klaro.
Para maging efficient and effective yung services.
Sagad na.
Mataas pa nga sir sila sa 102% na sila ngayon.
A moment, Mr. President. I'm just conferring with the agency to provide us.
While the sponsor is checking with our resource persons, just for the additional information of our minority leader, we have to distinguish, Your Honor, between a DOH-funded hospital and a locally funded hospital insofar as bed capacity is concerned. Insofar as a DOH-funded hospital is concerned, they will automatically fund the increase in bed capacity not only in terms of MOE, but also in terms of PS.
Yeah.
Because for every increase in bed capacity, there is a required increase in the number of doctors and nurses. And you are speaking of permanent items, Mr. President, Your Honor. But in the case of local hospitals, actually, I would commend local government units who are asking for an increase in their respective bed capacities because this will be a toll in their budget. Because for every increase in bed capacity, as I said, will require corresponding items for nurses, medtechs, and doctors, which will not be found in the GAA, but in the budget of the local government unit concerned. And that is why there is a disincentive for locally funded hospitals to actually increase bed capacity by law, even if their hospital was established by law, because they simply cannot afford it. And DOH will not give them accreditation if they do not comply with their requirements. But complying with their requirements, as we discussed the other day, would mean exceeding their PS cap as mandated, on the other hand, by the local government code. I believe the sponsor is now ready to give the answer to the minority leader.
Thank you, Mr. President. Mr. President, sa Region 3 alone, Central Luzon is ang kanilang kakulangan po sa hospital beds ay 5,349 beds as provided by the Philippine Health Facility Development Plan. Kulang talaga, including na po itong sa Bataan General Hospital. And the ideal rate is 85% occupancy rate. Ngayon po, umaabot na sila sa 100%. So, kailangan po talagang, aside from sa kanilang planong maglagay po ng cancer center dito, ay kailangan i-upgrade po from 500 to 1,000 ang kanilang hospital beds.
Okay. So anyway, there are days na more than 500, there are days siguro na less than 500 ang mga confined sa hospital. Ganun po ba yan?
Correct,
The reality on the ground, tinatanong ko lang po yung reality on the ground.
Correct, Mr. President. Gaya ng nabanggit ko sa Region 3, sa
Yes,
kabuuan,
pero-
no? 5,349 beds ang kanilang kulang
okay,
pa. The gap
Okay.
for Level 3 hospitals in Region 3. Buong Central
Yeah, so
Luzon.
are we expecting na kunyari the shortage is in another province? Are we expecting that those in need of a hospital bed will now go to the Bataan General
That
Hospital?
is possible,
Ganun ba?
Mr. President, since DOH hospital naman po ito and hindi naman to LG hospital. Usually, kinikater talaga yan. Lalo na lalagyan nila ng cancer center. Doon talaga tatakbo itong may sakit sa cancer, Mr. President. That's the nearest specialty center na pwede nilang lapitan sa pagpapagamot sa cancer, Mr. President.
Sige. So, yes, I get it, Mr. President. Yung shortage na 5,000 plus beds, we are just counting the or using the data from the DOH hospitals?
Yes, Mr. President.
Oh, so pwedeng mas masama pa given if we collect the data from the local hospitals and even the private hospitals.
Correct, Mr. President. Actually, nung panahon ng pandemya, yun ang naging problema natin, Mr. President. Nabigla tayo, kulang-kulang yung mga kama at ang daming mga kailangan pa nilang magkaroon ng maghihiwa-hiwalay, di ba? Meron pa tayong tinatawag namin yung mga isolation facilities na kailangan natin, yung magdistansya, nalimutan. Social distancing, yun talaga, hirap na hirap tayo noon dahil kailangan nilang hindi magkakatabi-tabi noong panahon ng pandemya. Overwhelmed talaga yung mga hospital natin. Mas mabuti na rin sigurong handa tayo sa anumang pandemyang darating sa buhay natin. Mas mabuti ng sobra kaysa magkulang at nabigla tayo.
At saka may time lag po ito, no? Even if we approve this bill, it becomes law. Hindi naman automatically maka-accommodate na sila ng 1,000 patients agad. There's a
Correct.
time lag. Yeah.
At marami pa silang
Yeah.
dapat na i-improve. Halimbawa, baka wala pa nga silang budget na pambili dito sa mga kamang idadagdag nila, Mr. President.
From the experience of the DOH, whenever we increase bed capacity, ilang years bago nila ma-achieve yung new bed capacity po nila? Yung ma-achieve in the sense na pwede na ma-avail po ng publiko yung the stated
According to the DOH,
capacity.
Mr. President, about 2 to 3 years po, Mr. President, bago pa nila ma-achieve itong, kahit ipinasa natin itong batas na ito, Mr. President, kailangan nila ng budget, kailangan nila ng additional personnel to cater dun sa kanilang targeted na capacity.
correct 2 to 3 years na time lag. How about in the creation of a multi-specialty hospital, when we convert a general to a multi-specialty, may naman yung time lag before they can now offer. If the plan of Bataan is to be a cancer specialty hospital, how many years muna bago nila ma-announce sa publiko, we are ready to be a cancer specialty hospital?
Mga 3 years din po, Mr. President.
Okay, so
Just want to cite yung Republic Act 11959, Mr. President, yung ipinasa natin na regional specialty centers. It's a multi-year plan of the government sa loob po ng 5 taon po ito. Kanilang planong magdadagdag po ng mga iba't ibang specialty center. Ongoing na po ito, Mr. President, even prior to the passage of that law, Mr. President. Isinabatas lang po natin para yearly magkakaroon po siya ng sariling budget, Mr. President.
Hindi po ba since DOH Hospital si Bataan General Hospital, hindi po ba siya beneficiary nung law na yon na binanggit po ng ating sponsor?
Beneficiary na rin po siya, Mr. President. Kaya lang po, gusto nilang i-klaro dito sa batas na magkakaroon sila ng multi-specialty and at the same time increasing the bed capacity, Mr. President.
So yung ating pinasang batas on regional specialty hospitals, kahit hindi natin i-upgrade si Bataan General Hospital into a multi-specialty hospital, beneficiary siya doon. Pwede niyang lagyan ng cancer center ang kanyang hospital.
Pwede,
Correct.
Mr. President.
Okay.
Since nasa batas, selected DOH hospitals, since pasok siya doon.
Pasok siya,
Yes,
kasama
Mr.
siya.
President.
Opo.
DOH hospital po siya, Mr. President.
Pero that law that our sponsor mentioned on the regional specialty hospital cannot touch the bed capacity. So we
Correct.
so
Correct,
we still
Mr.
need
President.
we still need this measure on the bed capacity.
Correct, Mr. President.
Okay, so one very interesting provision on the bill, Mr. President. Itong section 7. The BGHMC, in collaboration with government agencies, instrumentalities, entities, or authorities, may enhance or extend its services to address the health and medical needs of the population of Bataan. May we get the sponsor's interpretation of, or explanation on how Section 7 will work?
This section was proposed by the author, Representative Albert Garcia, Mr. President. He requested that this be included in the bill so that it will be clear that the hospital has the mandate to bring its services to the entire population of Bataan, and not simply to wait and accept patients. He wants the hospital to be proactive, which we also support, and to be able to do that, the hospital can collaborate with other government agencies that have resources or facilities to help the hospital do this mandate, Mr. President.
Will Section 7 have a budgetary implication, Mr. President?
Wala naman po, Mr. President.
So,
Initiative.
pwede siyang chargeable to the MOOE of the hospital. Tama? Ito ba yung mga outreach po ba ito?
Yes, Mr. President.
Mag-outreach sila?
Yes, Mr. President.
Okay, meron kasi tayong phrase dito na population of Bataan. Ngayon, ang tanong ko yung ating increased bed capacity, yung ating specialty center, nasabi kanina, they can cater to Region 3 and even maybe, hindi pa tayo nagbibigay ng wrong signal dito na the hospital services might be limited to the population of Bataan?
DOH hospital po siya, Mr. President. So it's
So why the mention of population of Bataan sa Section 7? Nasa dulo po, sa last.
yung mga for outreach lang po, Mr. President. For Bataan. Pero itong DOH, Mr. President, it's possible na pwede talaga nilang i-cater lahat, no? Regional po siya. Parang bawal naman nilang tanggihan yung mga taga Pampanga, taga Zambales if they will avail of these services. Halimbawa, Mr. President, walang cancer center dun sa lugar. Yun po yung pinaka nearest na DOH hospital. Unang-una, ang DOH, it's funded by national government.
Right.
Para po yan sa Pilipino, Mr. President.
Mga taga Isabela, pwede rin. Welcome din dyan sa Bataan General Hospital.
Yes, Mr.
Outside
President.
of the region na po yan. Pwede.
Yes, Mr. President.
Okay.
Yes, Mr. President. But the catchment, the primary catchment target po nito, Mr. President, yung mga taga-Bataan. Ang secondary naman niya, Pampanga at Zambales. Kasi yung mga taga-Isabela naman, Mr. President, medyo malayo yon. Meron namang mga DOH hospitals rin po na malapit sa kanila na pwede nilang, halimbawa, sa Cagayan Valley, may mga DOH hospitals po tayo doon. Ang Isabela is Region
2.
Region 2, no?
That's why I use it as an example outside of the region.
Yes, pero
So, but theoretically, legally, per
Yes.
per regulations,
Legally,
nothing prevents it.
nothing.
Yes.
Nothing.
Welcome
karapatan
lahat.
po,
Welcome
karapatan po ng bawat Pilipino, Mr. President, na magpa-admit.
That's
sa
why, Mr.
DOH
President,
hospital.
that's why I'm bringing to the attention of the sponsor the Section 7 that there is a specific mention of the population of Bataan. Siyempre pagka linagyan ka ng hospital sa lugar mo, logically, ang beneficiary, main beneficiary would be the people living in the surrounding areas of the hospital. Siyempre, kasi proximity. But do we really need to say this, Mr. President? To mention the population of Bataan, hindi ba tayo magkakaroon ng ano rito? Hindi ba tayo magkakaroon ng parang message na parang they are priorities of the hospital? Dapat open to everybody po itong hospital na ito.
Hindi naman po, Mr. President, dahil unang-una, yung ibang mga, halimbawa nga sabi mo kanina sa Isabela, may mga regional hospitals naman rin po sila doon. Pero kung halimbawa na napunta sila dito sa Bataan, at nagkataon, nandun yung mga kamag-anak nila, na-admit sila doon, wala pong bawal at pwede sila. Pero but the primary catchment is Bataan, and of course, ito pong nearby provinces. Ang nakalagay naman po dito, Mr. President, may enhance or extend its services to address the health and medical needs. May po.
What's the main idea, Mr. President? Ano ba talaga?
Parang
Anong balak gawin ng BGHMC using Section 7? Can we just understand? Kasi kung maganda i-incorporate natin sa lahat ng bills ganyang idea.
Ang ano nila? Plano po, may enhance nga po, Mr. President. Meron silang mga medical mission o outreach program doon sa Bataan, Mr. President.
Kung wala itong section na to, hindi magawa yon?
Pwede naman. Pwede naman, Mr. President. I-reiterate lang po nila, Mr. President.
May enhance or extend its services. Ano po ba meaning nito?
Pwede naman itong tanggalin, di ba?
Extend its services, pwede. You're going outside of the hospital. Yun, na-extend. Pero ano yung sabihin ng enhance, Mr. President?
Actually, Mr. President, itong Section 7 na ito, pwede rin pong itong i-delete, Mr. President. This section was proposed by the author, Mr. President, Congressman Albert Garcia.
Sana po inalam natin what he wanted to achieve. Yun lang naman, kasi kung ulitin ko ang position ko rito, kung maganda, then we can use this as a model for the other hospitals. So, pero kung pwede naman, kung wala rin pala itong Section 7 and then the objective can still be achieved,
possible, Mr. President, no, kung gusto nilang mag-conduct ng medical mission, pwede silang makahiram ng mga equipments, doctors dito po sa Bataan BGHMC, Mr. President.
No, baliktad, sir. Sa example po ng ating sponsor, the impulse is coming outside of the hospital, asking for the hospital's help. Okay yun. I mean, ito kasi, Section 7 it's the hospital. The impulse is coming from the hospital. And they want to enhance or extend their services to address the health and medical needs of the population of Bataan.
Makakuha sila sa...
Parang...
Mr. President, di ba sa Bataan Freeport area, pwede rin po silang humiram doon ng mga kagamitan. I'm sure meron niyang mga fasilidad rin po or mga medical equipments, the ambulance, mobile clinic, Mr. President.
Kaya are we encouraging DOH hospitals? Is this a DOH regional hospital? Ito ba yung karangko ba nito yung Northern Mindanao Medical Center o hindi?
Hindi po
Hindi
yata,
po.
Mr. President.
Okay.
Hindi pa. Hindi siya considered as a regional, Mr. President.
Okay, are we encouraging, is the DOH encouraging their hospitals to have specialized programs focusing on the population where it is located, where up to the province of where it is located? Does the DOH want that? Or ano? Or gusto ng DOH na huwag na natin ilagay yan para pwede niyong gawin, pwede rin kayo lumabas sa provincial limits ninyo.
Alin lang?
As a matter of policy.
Bibigyan ng...
Bibigyan ng tulong po.
Lumalabas sila yung mga ospital kung kailangan ng tulong pero hindi talaga nila policy.
Then what's the policy from the DOH? Do we have a DOH resource person, Mr. President?
Yes, Mr. President.
Gusto ba nilang mag-appear ito sa mga laws creating their DOH hospitals?
Wag na lang. A moment, Mr. President, I'm conferring with the DOH representative.
Ito.
Pwede nila.
So gusto niyang talunan na ito.
Kasi wala pa siyang
Pero yan, anong panis? So, pag gusto ba nyo gawin yung panis yung so, sa ito, makatulong kasi wala kayo panis. So, pwede nyo yung gawin yun. Binigyan nyo yung
Mr. President, according to the DOH now, with or without this provision, Mr. President, tumutulong naman po ang ating DOH, no? May mga medical mission upon request, Mr. President. Sa ngayon. So, with or without this provision sa Section 7, according to the DOH, willing po silang tumulong, Mr. President.
So the Section 7, kahit wala yan, does not affect any of the operations or activities of the hospital?
Yes, Mr. President.
Okay, so it will be less controversial, Mr. President, kasi baka kopyahin ng ibang laws and then mag-ipa-amend nila
To delete na lang.
with this in mind, Mr. President. Now, Mr. President, so with that, can we move on to the next bill? Ito lang po napansin natin to Municipality House Bill 8483, Municipality of Rodriguez, Montalban, malapit po to dun sa amin sa Marikina. Ito naman po ay establishing a new hospital. Tama po 'yon? Tama po ba 'yon? Bago po ito, the Northern Tagalog Regional Hospital. Tama po.
Correct, Mr. President. There shall be...
And then, I notice it's immediately a level 2. Kasi usually ba, when we establish a new hospital, that's a general hospital and that's a level 1 hospital. Ito, level 2 na. So, is this...
Existing na siya, no?
Ano itong, ito namang next. Ito na ako nakatingin. Ito, tertiary. Ano siya, level 3? Tertiary na. Hindi nga register. Tertiary is level 3.
Recommendation nila.
O, itong sa Baena.
Mr. President, according to the DOH, the gap for level 2 hospital beds in Rizal is 1,671 beds. Of the 35 hospitals in Rizal, 26 are private na 9 are LGU hospitals. Kaya gusto na po nilang gawing level 2 ito, Mr. President. At since budgeted naman po ito, since 2021, nagkaroon na po ito ng budget na 50 million, 2022, 200 million, 2023, 80 million, and 2024. Tuloy-tuloy po itong pagtatayo nitong Northern Tagalog Regional Hospital dyan po sa Rodriguez, formerly Montalban, Mr. President.
Bago po ito.
Correct, Mr.
Bago.
President.
O
Yes,
ngayon,
Mr.
when we establish a hospital, so this is a general hospital, except that level 2 agad. Tama
Yes,
po ba?
yes, Mr. President.
Normally, we establish a general hospital. When we say general hospital, level 1. Tama po ba yun? When we do not mention the level of a hospital, and it's created by law, a general
Pwede
hospital,
po,
that is a
pwedeng
level 1 hospital.
Mr. President, pwede na pong diretso na level 2, depende po sa pangangailangan at needs po, Mr. President.
Okay, so this is, ito na yun. This is what we're doing. Diretso level 2.
Yes, Mr. President.
Yung bed capacity ng level 2 hospital, is it stated in the law creating it?
Wala pong specific bed capacity pero ang ideal is 300 to 200.
It was not stated, Mr. President, but the ideal is 100 to 200 bed capacity, Mr. President.
So here, Mr. President, we have an example where there is a law creating general hospital level 2 with no stated bed capacity. So therefore, ang pag-increase ng bed capacity nito in the future, hindi na kailangan bumalik sa Kongreso. Tama?
Pwede rin dagdagan, di ba? We can.
Kasi walang specified size.
Hindi. Pwede rin natin i-specify, Mr. President, ang
Hindi, Mr. President, I'm totally alien to this subject matter kasi abogado naman po ako, hindi naman ako doktor. Tinatanong ko lang kasi yung bed capacity, hundreds of bills na yung ating pinaprocess increasing kasi nga yung original law establishing the hospital establishes or mentions the bed capacity of that hospital. This one in Montalban
pwede lang.
avoided mentioning the hospital bed capacity. So, is this the way to do it? Maybe. Yeah. Kaya nga, probably. That's why I'm bringing it up to the attention of the Senate President. Look at Section 2 of House Bill 8483. Is this the solution that we've been looking for, Mr. President?
A moment, Mr. President. Tatanong ko rin dito sa DOH kasi tama ka, you're correct, Mr. President. Bakit sa iba naka-stated yung mga hospital beds? Ito hindi nila in-state. So I'm also interested dito, Mr. President.
The chair completely agrees with our minority leader, as indicated by the chair earlier. Perhaps this will lighten the burden of Congress. If we can simply either leave it to DOH, be silent about it, or make it dependent by ratio and proportion to the population of the area it is serving.
Can we have a minute suspension so we can
Session is suspended.
Yes, off session we can
Although the idea of the minority leader initially excited the chair, as agreed upon during the recess, we still proceed with what the minority leader calls the old way, and shall specify the bed capacity for this particular measure in Montalban, but to reflect the maximum for a level 2 hospital or 200 beds, which may I suggest to the sponsor to reflect in the period of amendments.
Yes, Mr. President, I agree with you, no? Kasi kanina merong mga hospital bills na naka-indicate yung increasing. Ito naman hindi. So dapat ako mismo ay gusto kong nakalagay rin po mismo. But may I suggest na ilagay po natin doon sa maximum po, Mr. President.
200. That is the maximum for a level 2 hospital.
Yes, Mr. President.
And just a caveat, Senator Go, this is without prejudice to the committee exploring the new way being referred to by our minority leader in order to unburden the committee insofar as future local bills increasing bed capacity, if we can simply delegate this authority to the Department of Health, as contained in the separate bill that the sponsor talked about during the recess. The gentleman may proceed. Senator Pimentel is recognized for his continued interpolation.
Thank you for that, Mr. President. I think the House has discovered a new way, because if you look at House Bill number 9623, ito naman yung sa Municipality of Bae, Province of Laguna, Level 3 General Hospital. If you look at Section 2, ganun din. There is no hospital bed capacity specifically stated, Mr. President. So, bantayan na lang natin ito, Mr. President. If we are not yet convinced of this new way, so if I can make an omnibus motion for the committee to go over the bills and look for this particular section with the following words: any future increase in bed capacity, healthcare facility, service capability, and human resource complement shall be based on the hospital development plan that shall be prepared by the DOH. That is found, we have already found 2 bills na kasama yan. Iwala naman siyang, ang opening phrase niya, any future increase in bed capacity. Pero wala naman siyang in-state na original bed capacity niya. So we have already found 2 bills. I do not know how many bills. So
May the chair suggest, if with the conformity of the minority leader, for the sponsor to specify the bed capacity in those bills where it does not state a bed capacity during the period of amendments, and to include an omnibus amendment as suggested by Senator Pimentel, that future increases shall be in accordance with so on and so forth.
that is not what I meant. I just read actually the sections found in the bill. So kasi ganito, Mr. President, if we state a bed capacity, then we have to follow, if we state a number, and then in the future we want to increase it, then that amounts to an amendment to a law. So it has, the proposal must come back to Congress. I'm sure naisip na rin nila ito, kaya that's why linagay nila itong Section 2 na to. But ang tanong lang natin, will this not be open to abuse, especially in the budgetary process, Mr. President? Kasi we have established earlier, kada bed increase may effect sa budget eh. That's why that may be the reason why Congress needs to also authorize the increase in bed capacity, Mr. President.
So what is the pleasure of the minority leader? To specify or to adopt this particular new method and see how far it goes insofar as these bills using the new method is concerned? What is the pleasure of the minority leader?
We have to study the new method, Mr. President, and be convinced that there will be no anong tawag mo doon?
Abuse.
Consequences, ano yun? Unintended consequences, especially on the budgetary process.
Then we specify.
So, we better be conservative and we follow the old way
So we specify.
Yes, Mr. President.
During the period of amendments.
But my point is, I am in no position to go over all of the bills and look for this section, this new way of tackling this bed capacity. So I'm appealing to the committee itself, not only the chairman, but the entire workforce of the committee to go over their pending bills, Mr. President.
What does the sponsor say of
I'm,
these
uh,
11 bills or measures we are taking up now? Aside from the 2 bills mentioned by Senator Pimentel, are there any other bills that does not make mention of the number of bed capacity?
Tatlo lang po dito, Mr. President, ang hindi nakaspecify sa mga new DOH hospitals, Mr. President.
And they are which ones? Which ones, Senator Go?
Ito pong Municipality of Rodriguez, House Bill number 8483. Ito pong House Bill 9623 and establishing in the Municipality of Bay, Province of Laguna. Ito hindi rin po nakaspecify. At ito pong yung sa Bataan, no? Another new, establishing the city of San Jose, Province of Nueva Ecija General Hospital to be known as San Jose, Dr. Eleuterio Biolago, Mother and Child Hospital.
Senator Go, even House Bill number 8484 contains the same provision on Ilocos Norte. It does not make mention of the number of bed capacity as well.
Local hospital po ito, Mr. President.
I agree, but these local hospitals also contain that.
Kailangan po ba?
It's a similar provision.
A moment, Mr. President, conferring with the agency.
Session is suspended.
Sana ba tayo? Something.
The distinguished sponsor, Senator Go, and our minority leader, Senator Pimentel, still have the floor.
Sa LGU.
Sige po, Mr. President. I think marami naman tayo na pag-usapan during the suspension, and then we have some idea on how to move forward, Mr. President. Ito lang po, question lang po, Mr. President. House Bill 9335 upgrades Basilan General Hospital into a tertiary hospital. House Bill number 9623 establishes a level 3 general hospital doon naman po sa Laguna. Just for my education, iba-ibang words ginagamit natin. Is there a difference between tertiary hospital and level 3 general hospital?
The same, Mr. President.
The same, and yet we want to keep on using different. What is the correct? What's the correct term, Mr. President?
Level 3, Mr. President.
So can I appeal that we use level 3 para
Yes, Mr.
para
President.
yan para standard po na madaling maintindihan?
Yes, Mr. President. I agree with our minority leader.
Ito po ba yung, ang level 3 po ba is about the functional capacity of the general hospital? Yan po ba yun? Ito ba yan?
Yes, Mr. President.
So, ito ba yon? Tama po ba itong aking notes na ang level 3 hospital, for example, itong ginagawa natin sa Bae, Laguna, its functional capacity will include all level 2, and then teaching or training hospital din siya, it must have a rehab unit, ambulatory surgical unit, dialysis facility, it must have a tertiary lab and level 3 imaging. Yun po yun?
Yes, Mr. President.
Okay. And then yung mga tertiary lab and level 3 imaging, I'm sure meron ng ano yun, may kanya-kanyang characteristics na po yun.
Yes, Mr. President. Mas upgraded na siya, Mr. President.
Level 3 imaging. Okay, so we will see all of these functions in the general hospital, which we will establish in Basilan kasi tertiary siya, level 3, and then the one to be established in Bae, province of Laguna. Tama po 'yon, Mr. President?
Yes, Mr. President.
So magkamukha sila ng kanilang mga services to be given to the public. Ngayon, ito pong House Bill number 9624, which is establishing a nagulat ako na pangalan ni Senator Angara noong 9624. Ito, the correct title now is 9624 of House Bill establishes a general hospital. Okay. When the DOH uses simply the term general hospital, ang ibig pong sabihin nito, level 1 po ito?
Yes, Mr. President.
Okay, so I get it, Mr. President. Okay. So, pagka time na to graduate to level 2, babalik po tayo sa Kongreso at i-amend naman po natin ang batas. Tama po ba yun?
Pwedeng hindi na po, Mr. President. Pwede nilang i-apply no, sa DOH for level 2 sa licensing.
Okay, so kunyari itong Montalban, balik ako sa Montalban, na House Bill number 8483, we are establishing sa law, sa title mismo, a level 2 hospital. So kung mag-graduate ito at gusto niya maging level 3, kailangan siya bumalik sa Congress?
Yes, Mr. President.
Tapos pero itong General Hospital na sa Nueva Ecija na level 1, kung gagraduate na siya to level 2, hindi niya kailangan bumalik sa Congress?
According to the agency, Mr. President, sa DOH, no, ang General Hospital considered as level 1 and
Level 1 muna kapag general hospital lang.
Ba't local ba ito? Itong
Na-apply doon sila sa
for level 2.
itong City of San Jose. General Hospital.
Hindi kailangan ng law.
9624.
Hindi na po kailangan kasi expired lang.
City local?
Kaya 1, 2, 3. Pero dahil nabili ko naman kasi level 1, mag-apply sa pang level 2, starting from level 3.
Mr. President, kung tutusin itong ating line of questioning, we are exploring ways to
Correct.
help, to help streamline processes. If we can find solutions.
I agree with you, Mr. President.
Wala tayong kiniklaim na hawak natin yung solusyon, but we must ask these questions para kung sakaling makatulong po tayo.
Yes, Mr. President. I'm open to amendments, Mr. President, para
Okay.
mas streamline natin to at mapabilis natin to.
Kaya Mr. President, okay. House Bill 9624, establishing in the city of San Jose, province of Nueva Ecija, General Hospital to be known as the San Jose City Mother and Child General Hospital and appropriating funds therefore. Ang term na ginamit, General Hospital, that is level 1 General Hospital. Klaro. Klaro. Pag dumating ng time, after a passage of a couple of years, na handa nang mag-graduate itong General Hospital ng Dr. Eleuterio Biolago, Mother and Child General Hospital. Ready na siyang to graduate to level 2. Kasi in-establish siya ng law as a General Hospital, ang understanding natin level 1. Ready na siya mag-progress to level 2. Kailangan ng amendment ng law o hindi?
According to the DOH, Mr. President, naging quiet po raw yung General Hospital. It was not indicated in the bill na level 1 siya. So pwede silang mag-apply to sa DOH para maging level 2 hospital, Mr. President.
Okay, and there is kahit hindi i-amend ang law, walang legal question doon.
Wala, Mr.
Okay.
President.
So possibly hanggang itong General Hospital na ito ay aabot sa level 3 without even coming back to Congress for an amendment. Posible? Level
Yes,
3.
yes, Mr. President.
Level 3, correct?
Correct,
Okay.
Mr. President.
Samantalang itong mga ginagawa nating ibang bill, like sa Montalban, na in-specify natin na it's a level 2 hospital, although it's still also a level 2 general hospital, tama? And then, pag mag-graduate na siya to level 3, kailangan niya bumalik sa Congress?
Yes, Mr. President. Since
Okay,
naka-specify.
So it looks like itong House Bill 9624 is more flexible than the other House bills.
Correct, Mr. President.
Okay, so let us, if 9624 as written contains benefits for the general hospital that we are creating, why should we not extend the benefits to the other general hospitals that we are creating?
Yes, Mr. President, mas mabuti. Lagay na lang nila lahat, General Hospital din, since mas flexible at mas madali nilang i-apply sa DOH ang kanilang pag-upgrade, Mr. President.
So with that manifestation from the sponsor, Mr. President, isa sigurong one last look ng committee, repasuhin po nila ito. If there is a pattern, if we have discovered a phraseology which solves a lot of problems, then let's make that the template or the pattern that we will follow, Mr. President. So, baka, Mr. President?
Yes, Mr. President. I agree with our minority floor leader, Mr. President. We can amend, Mr. President.
But the question, Mr. President, before we really pursue this course of action, why in the first place do we exert the effort of mentioning the level of the hospital in the law creating it? Kasi nga, baka naman just like sa bed capacity, kung papabayaan natin yun, hindi natin na-state, baka may budgetary implication din kasi nga, iba-iba yung functional capacities ng levels 1, 2, and 3 General Hospital. So, I know DOH wants the delegation of the authority. Ang tanong lang, does Congress want to retain the authority? We retain the authority to determine bed capacity because it has budgetary implications. We retain the authority to determine the level of the General Hospital because it has also budgetary implication.
sila naglagay, no? Mr. President, ang Congress po ang naglagay nito, no? Mga level 1 or level 2, Mr. President. But I agree with you, Mr. President, dito sa concern mo, no? Para hindi na tayo pabalik-balik, no? Kasi
No, I do not want to summarily dismiss, Mr. President, yung paglagay nila ng level 1, level 2, level 3 kasi baka nga may budgetary implication, Mr. President. Kaya nga baka nga mas may wisdom yun Mr. President. Kaya nga baka pati yung bed capacity ini-state kasi may budgetary implication. At least kita ng Congress yung budgetary implication, Mr. President.
depende rin sa kanila. According to the DOH, Mr. President, depende po yun sa Congress, no, or sa sponsor nila na pinalagay talaga nila yung level mismo. Meron ring iba na gusto lang ilagay General Hospital at doon na po sila magpapa-upgrade sa DOH.
Yes.
Mr. President.
Yes, I get it. Yes, Mr. President, pag sinabi lang General Hospital, you have to really start at level 1.
Yes, Mr. President.
Okay.
But
So
it is flexible, Mr. President.
That's the that's all. That's the parang may pros and cons. Yung negative nga nun, you start at level 1, pero yung positive naman doon, you have the flexibility na pwede ka nang umabot hanggang level 3 by administrative action. No need to
Yes,
return
through-
to Congress.
Yes, Mr. President. Through DOH na lang po. Pwede nilang i-upgrade from level 1 to level 2, assuming pasado sila doon sa criteria, Mr. President, up to level 3. Yung iba naman, gusto nilang i-specify at ilagay sa kanilang House Bill yung level 1 or level 2. Depende po sa kanilang kapasidad to operate ng hospital, Mr. President. And of course, the consideration dito yung budgetary, Mr. President.
So thank you for that, Mr. President. Siguro, Mr. President, I just need more education on the subject matter. If DOH can give us in writing na lang na, for example, for every increase in bed capacity from experience, ano ba yung budgetary implication? For every promotion in the level of the hospital, ano naman ang budgetary implication? Siguro in writing na lang, Mr. President.
Yes, Mr. President.
Maybe you know how soon the DOH can give us? For our education lang, turuan lang niya po kami para lang po naintindihan namin.
Next week, Mr. President, we will require the agency, Mr. President. Tuesday, Mr. President.
Duplicated in the city na, inalista niya. Pinanggalan niya. So thank you, Mr. President. So let's now go to the local hospital bills. Ano po ba ang difference ng local, yung LGU hospital bills kaysa dun sa ating previously discussed DOH hospitals? Ano po main difference po nila, Mr. President?
Pag LGU hospitals, Mr. President, ang personnel services ay manggagaling po sa LGU. Ang MOOE nila galing rin po sa LGU, Mr. President. But kaya lang gusto rin po nilang maisabatas ito dahil pwede rin po sila mag-avail through the national government, through the Health Facility Enhancement Program, Mr. President. But lahat po ng pagpapatakbo ng mga LGU hospitals ay mula po ito sa LGU, local government units, Mr. President.
So there are LGU hospitals created by LGU ordinances and there are also LGU hospitals created by law? Ganun po ba yun? Ito pong lahat nasa harap natin are the LGU hospitals created by law?
A moment, Mr. President. Hindi, itong LGU, ang tinatanong niya, may
1 minute,
local batas
Mr.
ba?
President.
Session suspended.
Mr. President,
Session resumed, brother.
ang yung mga LG hospitals, Mr. President, I'm sure, no, meron yan silang mga local ordinance, meron silang local na batas creating their own hospitals. Ito naman, gusto nilang isabatas ito para po pwede silang maka-avail ng mga tulong mula sa HPEP o mula sa national government, Mr. President.
So yan po yung difference, Mr. President. What is that program that the LGU hospitals can run to for assistance?
Ito po yung programa po ng DOH, itong Health Facility Enhancement Program, Mr. President, the HPEP.
HF.
Yun talaga ang usual nila na takbuhan, Mr. President, no? Na tulong mula sa national government. Halimbawa, itong mga hospital nila, kulang ng ultrasound, wala silang ambulansya, wala silang mga CT scan, pwede silang makapag-avail. Kaya gusto nilang maisabatas po ito, Mr. President, itong mga LGU hospitals, Mr. President. Sa tanong mo naman kanina, Mr. President, na kinreate ba sila ng law? I'm sure, and I'm conferring also with the DOH, meron siguro silang mga local ordinance dyan, creating those hospitals, Mr. President.
Yes, is there a local hospital created purely by ordinance?
Yes, Mr. President.
Okay. Can this hospital avail of HFEP funding?
Kailangan po nila ng batas natin dito, Mr. President, para maging part at maging prioridad sila ng HPEP, Mr. President.
So yun yung purpose, Mr.
Yes,
President.
Mr. President.
So yun yung practical difference nila, Mr. President. Okay,
Yes, Mr. President.
So ito po, this is since created by law ito mga to, yung upgrade nila following the earlier bills, ganun din kasi siguro naka-mention sa law nila yung level nila. So we are upgrading into level 2 hospitals. Pero kunyari yung upgrade to a level 2 hospital of a local hospital, of an LG hospital, yung budgetary implication po nun ay nasa DOH budget through the HFEP or
Yung local yun. Local.
yes, yung local
Pag
po.
local, Mr. President, sa kanila po manggagaling yung kanilang
Hindi kasi sir, ganito po I'm assuming si Bangi District Hospital sa Ilocos Norte, since we're upgrading it into a level 2 district hospital, dating level 1 siya.
Yes, Mr.
Oh
President.
yes, ngayon level 2. So ang level 2, binasa natin kanina yung mga functions niya. They may need new equipment, siguro specialists, ganon, etc. Can they charge this can they ask for the budget from HFEP?
Yes, Mr. President.
Yun, okay. So yun. So there is a budgetary implication. Hindi natin sasabihin na local funding ang sasagot. Tama po, Mr. President?
Yes, Mr. President.
Okay, so okay. At least that klaro po 'yan. And I'm sure na compute naman ito na natin na we can afford this, Mr. President. Ito yung sa Jordan. Saan yung malabo? Saan yung sige. Okay, so Mr. President, sa Victorias, we will be establishing a general hospital. So by law, but this will be okay, so ang HFEP po answers for facilities, equipment. Pero yung pasweldo po ng local LG hospital, wala pong budgetary implications sa DOH budget?
Wala po, Mr. President. LGU po manggagaling ang MOOE, ang kanilang personnel services, PS po, Mr. President.
So basta when we create local hospitals or we upgrade local hospitals, we increase their bed capacities, if ever may budgetary implication, this will be limited to the HFEP line item.
Yes, Mr.
Diyan
President.
lang. Para at least makikita din natin na parang may limit din po. Kaya, and if you notice, Mr. President, pag mag-increase nga ng bed capacity ang ating mga LGU hospitals, mga modest increases from 75 to 100, from 40 to 75 beds, kasi nga, yung ibang budgetary implication nito ay salo nila. Tama po, Mr. President?
Correct, Mr.
Correct. So
President.
that means I will assume na itong request na ito ay nanggaling po sa LGU. Tama. So
Yes, Mr. President.
I'm sure with the consent na ng LGU po ito. Ngayon, ito na lang po, last na lang po itong parang yung House Bill 9556. Ano po to? It just amends the existing law by deleting the name of the mention of the barangay where it is located. Saan ba dito? Tingin?
Mr. President, during the hearing, parang nagka-problema po yata sila sa lupa, no? So kailangan nilang i-amend po, no, itong pangalan ng kanilang, ialis lang po nila yung barangay, Mr. President.
Tsaka medyo interesting din yung pagka-state ng kanilang hospital beds, Mr. President. O minimum capacity naman ang kanilang nakalagay rito. Minimum capacity of 100 beds. So minimum ang naka-state, hindi po maximum bed capacity. But this is already existing law. The bill, tinatanggal lang po yung mention ng barangay. Ibig bang sabihin ito ay hindi pa po ito napuput up? Wala pa itong hospital na ito?
Wala pa po, Mr. President. Nagka-problema po sila sa lupa, Mr. President.
Yes, judging from the RA number, mukhang bagong relatively new law po ito. So yun lang po yun. I-cure lang nila so that they can locate the hospital anywhere in the city of San Jose del Monte, Bulacan.
Yes, Mr. President.
So,
para maipasa na kaagad ito, Mr. President,
Yes.
maipatayo na nila at magamit na po, Mr. President.
Pero yung pong napansin ko naman na nag-state sila ng minimum bed capacity, is that also a good way of determining bed capacity? Minimum ang approach nila? Minimum?
Okay naman po, Mr. President. Mas mabuti po yun na meron silang nilagay na minimum, or we can, gusto nyo, ilagay natin sa amendments. Lagyan rin natin ng...
May we know from DOH,
Yes.
what is the better policy to put a cap? Kasi yung iba kasi, Mr. President, very exact yung number. Ito, ito, incidentally ko lang napansin na minimum ang nilagay niya. It's a relatively new law, Mr. President.
Yes, Mr. President, but as agreed a while ago with our Senate President, we can specify during the period of amendments, Mr. President, if needed, no? But let me confer with the Department of Health yung kanilang category para ma-finalize po natin itong minimum or maximum hospital bed capacity, Mr. President.
Ang DOH ba, Mr. President, meron ba silang liaison to the Congress? O meron ba silang mga legislative din dyan? Parang legislative officers? Parang ganyan? Specializing in the drafting of laws, Mr. President? Meron ba silang unit or team dyan sa DOH?
Meron ba kaya? Yes, Mr. President.
Ang appeal ko sana sa team na yon,
Dapat nandito, Mr. President.
hindi lang sa dapat nandito, but find a way to standardize the way we approach hospitals, yung hospital beds, yung pag-phrase ng hospital bed, specific amount or range, pwede siguro, ganun. And then, yung level, tertiary, etc. Yung ating terminologies po, tulungan nila po tayo kasi may mga technical meanings po lahat ito. And ang assumption ko, since they are part of the DOH and then they are the ones assigned to legislative drafting, silang experts sa technical meanings po ng mga salitang ginagamit na madalas gamitin sa mga batas tungkol sa hospital at saka sa kalusugan. Ayan lang po yung aking appeal, Mr. President. Kung
Yes, Mr. President. I
pwede
agree.
tulungan nila po tayo. And then one final appeal na lang to our sponsor, Mr. President. I filed Senate Bill number 979, which is the Philippine Geriatric Medical Center Act, or yung hospital para sa mga senior citizens natin. Kasi nga precisely, regional specialization yung approach na nga natin eh. Pero ang understanding ko dun sa approach na yun, there is an apex hospital where the experts in the regions will get their training and their practice and their knowledge. So, ang approach natin ngayon, nakita ko, is on a per organ basis. May heart center, kidney, mga organs yan, lung, etc. Pero, siguro, since talagang iba talaga ang situation ng tumatanda na or matanda na, iba po talaga iba dapat ang approach ng medisina or ng doktor or ng professional dito po sa mga aged members of our society. From experience, nararamdaman na po natin yan, personal knowledge nito na iba na dapat talaga ang approach. Just as past human experience has told us na iba ang treatment sa mga bata. Hanggang from infant, toddler, teenager up to 18 years old, tinatrato pong iba ang situation ng kanilang katawan sa normal population. But pagdating na rin sa other side of the timeline, yung mga nagkakaedad, sa tingin ko iba na rin po dapat ang approach sa kanila. So if I may appeal to the sponsor to also prioritize that bill to create our specialty hospital for senior citizens' health issues, Mr. President, or so-called geriatric hospital.
Yes, Mr. President, I agree with you, Mr. President. Napaka-importante po nito. And in fact, na-hear na po natin ito during committee hearing sa Committee on Health, at ngayong araw na ito ay may pagpupulong po ang Department of Health personnel. Pag-uusapan at ifa-finalize po nila kung saan talaga most appropriate, no? And we are open to your suggestion, Mr. President, at paano natin matulungan itong mga para sa akin, Mr. President, it's very important po itong yung panukalang batas, Mr. President, para sa geriatric.
And then siguro, Mr. President, on a practical side, wag naman tayo maglagay ng hospital sa loob ng isang secured perimeter or gated area, Mr. President.
We will consider
hindi siya welcoming sa pasyente, dadaan ka sa checkpoint, Mr. President. Mga apex hospitals natin dapat sa mga areas na hindi po walang security concerns, Mr. President, na kailangan secure yung area. So, yun lang yung appeal ko kasi I think there is a health complex there, pero nasa loob po siya ng Malacanang security zone. So, Mr. President, I thank the sponsor for his patience. Nagtanong lang naman tayo, hopefully to improve specific bills and hopefully to improve the system, a system-wide improvement, Mr. President, so that we can adopt standardized terms, we can adopt a system, a flow chart, and then hinahanap natin yung situation na maybe some minor matters can be taken away from the burden of the Congress so that they may not need legislation anymore, Mr. President. So yun lang po yung purpose ng ating interpellation, and I'm sorry it took a couple of hours of your time, Mr. Sponsor, pero I hope nakatulong pa rin po tayo. Thank you.
Yes, Mr. President. Maraming salamat po sa iyong inputs, Mr. President. Mas mabuting mas streamline natin itong mga proseso, at ako mismo nalilito rin po ako sa kanilang paraan, no? May mga minimum, may mga maximum po sila, at dapat magkaroon tayo ng standard dito, Mr. President, para hindi na po paulit-ulit at mas mapabilis itong pagpasa natin ng mga hospital bills nito, dahil kailangan po ito ng ating mga kababayan, Mr. President, yung mga hospital beds. Ako mismo ay saksi dito sa pangangailangan po ng ating mga kababayan na kulang talaga ang ating mga hospital beds, kulang talaga ang ating mga hospital facilities. Marami pong pasyente na nangangailangan po ng tulong, lalong-lalo na po yung mga mahirap. Maraming salamat po, Mr. President.
Majority Floor Leader.
Yes, Mr. President, with the consent of the body, I move to close the period of interpellation of the said measures.
Is there any objection? Chair hears none. Motion is approved. Majority Leader?
Mr. President, with the consent of the body, I move to open the period of amendments of House Bill number 8484 and recognize Senator Christopher Bongo for his committee amendments.
Mr. President,
LGU muna.
basahin ko ito na. Lahat to.
Senator Go may proceed. I
Mr.
believe it's an
President,
amendment by substitution.
House Bill number 8484. Mr. President, in accordance with the Rule 29, Section 82, Paragraph 2 of the Rules of the Senate, I move that we amend House Bill number 8484 by deleting the entire text after the enacting clause and replacing the same with the provisions of the proposed amendment by substitution in the attached House Bill with committee amendments under Committee Report number 274 as filed with the Legislative Bills and Index Service last August 5, 2024. Further, I also move that the text thereof be considered as read into the record. I so move, Mr. President.
Is there any objection to the proposed amendment? Chair hears none. The amendment by substitution in accordance with Rule 29, Section 82, Paragraph 2 is hereby approved and adopted. Majority Leader?
Last 10.
LGU. Isa lang, isa lang.
Isang amendment lang. Isa lang miskin.
Close yun eh. Close na. Close lang, di ba?
Mr. President, with no other committee amendments, I move to close the period of committee amendments. I so move, Mr. President.
There being no objection, motion to close the period of amendments is approved. Majority Floor Leader?
Yes, Mr. President, with the consent of the body, I move that we approve on second reading House Bill number 8484. I so move, Mr. President.
Is there any objection? Chair hears none. House Bill number 8484 is approved on second reading. Majority Leader?
Mr. President, with the consent of the body, I move to open the period of amendments of House Bill number 8491 and recognize Senator Christopher Bongo for the committee amendments.
Senator Go is recognized. He may proceed.
House Bill 8491, Mr. President, in accordance with the Rule 29, Section 82, Paragraph 2 of the Rules of the Senate, I move that we amend House Bill number 8491 by deleting the entire text after the enacting clause and replacing with the same with the provisions of the proposed amendment by substitution in the attached House Bill with committee amendments under Committee Report number 275 as filed with the Legislative Bills and Index Service last August 5, 2024. Further, I also move that the text thereof be considered as read into the record. I so move, Mr. President.
Any objection? Chair? Senator Pimentel is recognized.
Because this is second time, Mr. President, we are going to approve now so-called substitute bill as attached in the committee report. What I have in my files would be still a House of Representatives bill, and then there are just bold-faced portions. Yun na yun? That's the amendment. Yes.
Secretariat answers in the affirmative insofar as the query of
And
the
these
minority is concerned.
These are very few amendments, Mr. President, and we do it through substitution. Bakit?
The answer given by the Secretariat is in the affirmative, Your Honor, because previously or in the past, they did it with 15 and even more bills, and when they read it individually, in lieu of this procedure that we are following, it took them a long period of time because each amendment would have to be read and approved individually. Hence, and it will be opened and closed each time,
Okay.
individually as well.
So
So it
it-
was in the interest of time that it was done by substitution, although the amendments are indeed, or indeed seem minimal.
Yes, so
For each
kaya-
one.
So para lang maklaro natin, it's not we are not amending by substitution because of the extensive changes we made to the bill, Mr. President. Kasi yung isa tatlong portions lang yung may amendment.
Given the bulk of the
Okay,
number of
the
bills,
number.
not so
Because of
much
the
the
number
bulk
of
of the
bills.
amendments.
Okay, so-
We thank the understanding of Senator Pimentel.
Thank you for that clarification.
There is a motion of Senator Go to amend the bill by substitution in accordance with Rule 29, Section 82, Paragraph 2 of the rules. Is there any objection? Chair hears none. Same is approved. Senator Go.
Amend the title to read as follows: An act upgrading the Dr. Catalino Gallego Nava Provincial Hospital in the municipality of Jordan, province of Guimaras, into a level 2 hospital, renaming it as the Dr. Catalino Gallego Nava Medical Center and appropriating funds therefor. I so move, Mr.
Any
President.
objection? Chair hears none. The proposed amendment is approved. Majority Leader.
Yes, Mr. President, with no other committee amendments, I move to close the period of amendment. I so move, Mr. President.
There being no objection, motion is approved.
With the consent of the body, I move that we approve on second reading House Bill number 8491. I so move, Mr. President.
Is there any objection? Chair hears none. House Bill number 8491 is approved on second reading.
With the
Majority Leader.
Mr. President, with the consent of the body, there being no committee amendments, I move to open the period of individual amendments of House Bill number 8492.
No committee amendments, Mr. President. No individual amendments.
Majority Leader.
Since with no other individual amendment, I move to close the period of amendments, Mr. President.
Is there any objection? Chair hears none. Period for committee and individual amendments are hereby closed.
With the consent of the body, I move that we approve on second reading House Bill number 8492. I so move, Mr. President.
Is there any objection? Chair hears none. House Bill number 8494
92.
92 is approved on second reading.
Mr. President, with the consent of the body, there being no committee amendments, I move to open the period of individual amendments of House Bill number 8494.
Any objection? Chair hears none. Motion is approved.
With no other individual amendment, I move to close the period of amendments.
Any objection? Chair hears none. Same is approved.
Wala na.
With consent of the body, I move that we approve on second reading House Bill number 8494. I so move, Mr. President.
Any objection? Chair hears none. House Bill number 8494 is approved on second reading.
Mr. President, with the consent of the body, there being no committee amendments, I move to open the period of individual amendments of House Bill number 8970. I so move, Mr. President.
Any objection? Chair hears none. Same is approved.
With no other individual amendment, I move to close the period of amendment.
Any objection? Chair hears none. Same is approved.
With the consent of the body, I move that we approve on second reading House Bill number 8970. I so move, Mr. President.
Any objection? Chair hears none. House Bill number 8970 is approved on second reading.
Mr. President, with the consent of the body, there being no committee amendments, I move to open the period of individual amendments of House Bill number 9556.
Any objection? Chair hears none. Same is approved.
With no other individual amendment, I move to close the period of amendments.
Any objection? Chair hears none. Same is approved.
With the consent of the body, I move that we approve on second reading House Bill number 9556. I so move, Mr. President.
Is there any objection? Chair hears none. House Bill number 9556 is approved on second reading.
Mr. President, I move that we suspend consideration of the aforementioned bills. The minority leader wishes to be recognized, Mr. President.
So before we suspend the bills, just an observation that on House Bill number 8492, which we approved, this will be placed in a special category or treatment, Mr. President. Wala siyang ano. This is I may be mistaken, but this is the only bill I've noticed na wala siyang hospital bed capacity mentioned. But we approved it.
But
so-
it's local.
Huh?
It's
Yes,
local.
but even the locals have hospital bed capacities, Mr. President.
Noted.
So, we just siguro on further study why this should be treated so differently compared to the others, Mr. President.
The committee is so directed. Thank you for your input, Senator Pimentel. Majority Leader?
Mr. President, I reiterate my earlier motion to suspend the consideration of the aforementioned bills. I so move, Mr. President.
Any objection? Aforementioned bills, the consideration of the aforementioned bills is hereby suspended. Majority Floor Leader?
Mr. President, with the consent of the body, I move that we resume consideration of House Bill numbers 3974, 3971, 5826, and 3972. These are bills declaring non-working holidays. I so move, Mr. President.
Is there any objection? Chair hears none. Consideration of House Bill numbers 3974, 3971, 5826, and 3972 are in order.
Mr. President, the parliamentary status of the subject bills is that we have sponsored the measures with the consent of the body. I move to have an omnibus interpellation on all the measures, considering that the interpellations of our minority leader, Senator Aquilino Pimentel, are applicable to all the aforementioned bills.
Any objection? Chair hears none. The motion of the Majority Leader is approved.
With the consent of the body, I move to be recognized as a sponsor of all the measures and to interpellate Senator Aquilino Pimentel.
Senator J.V. Ejercita is recognized to sponsor the four measures, and Senator Pimentel is likewise recognized for his interpellation. The gentlemen have the floor and may proceed.
Abandon na to. So, yes, thank you, Mr. President, with the permission of our sponsor. So, we are tackling four House measures declaring provincial level holidays. Tama? So,
That is correct.
Okay, so at least
President, Your
hindi
Honor.
na natin problemahin muna yung municipal level or barangay level holidays, Mr. President. So, and these are all special non-working holidays.
Yes, Your Honor.
What are the different kinds of holidays that we have, Mr. President?
There are two kinds of holidays. The regular holiday are referred to those declared as such under RA 9849 and other laws. Employees wherein the employee shall be paid whether they report for work or not during regular holidays. Employees permitted or required to work during regular holidays, however, shall be entitled to receive an additional 100% of their regular daily rate. The other holiday is a special non-working holiday, which shall refer to those declared as such under RA 9849 and other laws and Presidential Proclamation. Employees shall only be paid if they report to work on a special holiday. However, employees reporting for work on special holiday shall be entitled to receive an additional 30% of their regular daily rate as a general rule. So, those are the two holidays, Your Honor, regular and special non-working holiday.
Okay, so basically dalawa nga. Regular holidays, pero pag sabi holiday ito, yung common meaning ng holiday, no work. Tama, di ba? No work.
That is correct.
And then yung special non-working, what do we use? Special non-working days or special non-working holidays? Kasi si holiday already means no work eh.
Special non-working, di ba? Special non-working holiday, Your Honor.
Holiday. So
Yes.
we still use holiday.
Yes.
Sige. So let's also standardize our terms. So okay, so ilan po total sa buong bansa ang ating mga non-working days siya?
21.
Technically non-working day because basta ang rule diyan if you work
Kasi wala
may effect sa may effect sa daily sa hourly rate mo of work sa compensation. So how many all in all holidays do we have, both regular and special non-working holidays?
We have 20 national holidays, Your Honor.
Alam ko nga days kinagamit.
It should be 21, but EDSA People Power for 2024 was not declared a holiday, so there's about 20.
Hindi, teka muna, regular holidays means by law ito, di ba? Declared by law.
by proclamation.
May the chair
Yes,
intervene and clarify?
Yes, can you?
There are indeed 21 holidays, only that for this year, it was not declared as such because it fell on a weekend. Kasi po yung proclamation, dinedeclare yung mga araw na walang pasok.
Yes.
Hindi na kailangan i-declare ang walang pasok dahil bumagsak sa weekend yung EDSA People Power Revolt Day. But in theory, we have 21. Next year, we will have 22, which will include the election day.
No, but that's not the right. No. Just to be, just to have some, orderly flow on the regular holidays. By law, how many?
We have 12, Your Honor, Mr. President.
12 pala. Okay. And then the special non-working holidays also declared by law.
We have 9 special holidays.
Bakit 9? Bakit sa'yo kulang yung isa, mas 9? Okay.
Yes, we have 9 special non-working holidays, Your Honor.
Okay. 9 special non-working holidays. Yan ang term na gagamitin po natin. Okay, so 21 by law. But in reality, does the President order additional, kasi I think he's empowered, no? Is the President empowered by law to declare other days as non-working holidays?
Yes,
Yes,
he's
So in
allowed by
addition,
law.
in addition to the 21, itong 21 wala siyang choice, di ba? By law, okay. So in reality, in a normal year or on average, how many additional days does the President designate as a special non-working holiday, not due to calamities, not due to force majeure? Kunyari, si January 2, hindi ba dinideclare din niya yan na holiday? Na halos regular na ginagawa regularly? So ilan po yun?
Local holidays.
Ito po yung proclamation na dineclare niya. Total proclamation.
Total.
Si November 2, holiday din?
Ng 2022 po.
Pero hindi siya by law. Another example daw, si November 2. By law? Is November 2 a holiday by law?
With the permission of the gentleman, usually the gentleman is correct. January 2 is indeed declared a holiday, or minsan because of the holiday economics, so to speak, implemented by some administrations. Kung may naiipit na araw, tinatawag na nilang long weekend at dinedeklara na lang holiday yung gitna. On average, Your Honor, I believe by my own personal experience and not being an expert, about 3 holidays of such nature are in addition declared by the President on top of the local, municipality, city, or provincial holiday enacted by law or declared so by the President upon request of the local government unit.
Okay. In-establish lang natin ito na so halos lagay na lang natin na around 25 siguro. 25 Mr. President, 25 days in a year are designated by law as regular special working holidays and by presidential proclamation, discretion of the President.
Let us not sugarcoat it, Your Honor. It is more than 1 working month.
So more than 25?
No, 22 days lang naman ang
22
working
yes,
days in 1 month.
nga pala. 22
It is
days,
more
yes.
than
So,
1
sorry.
working month.
Yes, okay. So yun, more than one month in a year, you know, kasi ang implication kasi nito on productivity. Kaya natin ito pinag-uusapan actually. Because of the productivity of the nation. So okay, so that's the reality. Ngayon, we have 4 provinces here asking for measures for a provincial-wide special non-working holiday. Okay, how many provinces do we have right now, Mr. President? I've lost count na eh. 81 ba o 8 na nadagdagan na?
Ilan total pa?
Attorney Mavic should know by calling the COMELEC, Mr. President.
Yeah,
Because COMELEC should know how many provincial elections we will have. How many provinces do
We now have 82, Your Honor, Mr.
82,
President. 82 provinces.
And then of course, since we treat highly urbanized cities as separate from the province, how many highly urbanized cities do we have, Mr. President?
Total city,
HUCs? Okay. And then there are also some cities called independent cities. Are they also treated the independent? Ano ba meaning ng independent city? Is that the same as the HUC? Or separate pa, Mr. President? Can you help me?
They're about
To my
32.
knowledge, Your Honor, HUCs are classified as such based on their income classification, although it would still need the consent to be so classified and not vote for the province anymore. On the other hand, chartered cities would specify in their charter if they will vote or no longer vote for provincial officials, and will therefore be classified as independent
Okay.
cities or independent component cities.
It's only because of whether their constituents vote for the provincial officials or not. But if there is a provincial holiday, is the independent city covered by the holiday?
If there is a provincial holiday, meaning the city does not vote
Yes,
for the province.
right.
It would depend on the law declaring that holiday, I guess, Your Honor.
No, kasi kung yung HUCs automatic na yun eh. A provincial holiday does not cover the HUC.
Yes.
Of course, the
that's correct.
provincial holiday covers the component city. Ito lang special kind of and the independent city. Yun lang yung gusto ko sabihin. Ang tanungin ko, is that hindi ka natin alam kung ilan yung so-called independent cities.
I
Are
would
they
venture, Your Honor, that they would still be covered by the holiday.
Correct.
Because they, although they're termed as independent component cities, they still actually vote for provincial officials. It's only when they are classified as an HUC or their charter says so that they do not vote.
you know. Correct. It's only on the voting and whether or not they vote for the provincial officials. But so yun yung counted. So how many?
Your Honor,
Yes.
Mr. President, we have a total of 149 cities, of which 33 are HUCs, 5 are independent component cities, and
Component?
5,
Okay.
no, 5, and 111 are component cities, Your Honor. So 114 in total.
So the complete term pala, Mr. President, is independent component cities. So yung independent na word na yun is just because they do not probably vote for the provincial officials. But if there's a province-wide holiday, it's also a holiday in their area. So so our policy, which makes sense, di ba? Na since meron na ring provinces na nag-enjoy ng province-wide holiday, to be fair, we will allow all provinces to have at least one, or di ko nga alam kung ang policy ng SP natin is at most one province-wide special non-working holiday. What is the policy, Mr. President, that you want us to adopt? At least or at most?
Earlier, Your Honor, we reiterated the agreement in caucus that a province should have at least one holiday. That's okay. However, in one of the bills we are discussing, Samar, I believe, one of the municipalities already has a law declaring a holiday in that municipality.
Okay.
So if we pass this Samar Day holiday as a non-working holiday, essentially that town will have two holidays.
Yes.
The municipal one, which went ahead, was approved ahead, and the provincial one. So,
But
I
the
hope-
other towns of that province, wala.
Wala.
Kaya nga, inumpisahan ko to interpellation ko, sabi ko na we're talking about provincial level holidays. Let's limit ourselves to provincial level holidays.
But Your Honor, it is my understanding as well
Meron na kasi
I can be corrected by the gentleman who's a bar top nutcher. I am not. I believe that the local provincial board can declare a holiday in their province. If they should want to, within the territorial jurisdiction of the province. In fact, the governor can declare such a holiday in case of calamity, disasters, or floods. The point I'm driving at, Your Honor, is we were discussing earlier with the author so that we would not belabor with may holiday na ba, nauna na, pagbabawal ba natin sa probinsya, do we have to file another bill recalling that holiday in the municipality so that we can grant the one in the province? We were considering an amendment earlier to just simply pass in all of these proposed holidays, just to say that all of these will be working holidays, and that these will only be considered as non-working if the President issues a proclamation to that effect, which is the current practice now anyway. So that we won't belabor anymore, Your Honor, with possibly missing a holiday which the local government unit can declare anyway without us knowing it.
But Mr. President, ako kasi if the municipality already has a holiday, let's not take it against that municipality or that province. Bago we are just equalizing the holidays being enjoyed by our provinces at the provincial level. So kaya akong tanong, 82 provinces. Lahat ba yan ay meron ng province-wide holidays?
Not all,
Non-working holidays. Okay.
Not all.
Not all. Ito po bang apat na probinsya na humihingi ngayon ng special non-working holiday ay meron na ba silang existing provincial-wide non-working holiday? So number one, unahin natin, Samar.
Samar has two special non-working holidays. That's Calbayog, no, and the Santa Margarita.
No, the question was province-wide.
Province-wide, none.
But I welcome the input, Mr. President. So Santa Margarita is a town. Okay,
Yeah,
so
two
tama,
towns,
okay.
not
So maganda.
not province-wide.
So ang sagot at the province-wide level of Samar, wala pa.
Wala pa.
Ilan ulit po sa 82 ang wala pa? No province-wide level ano? Ilan po sa 82?
Sa 82 daw, ang wala pang province-wide. Meron ba tayong dito?
While we're waiting, the gentleman can reply to the original query. Of the four bills, which ones have a provincial holiday?
Isa-isahin natin, Mr. President. Maganda nga yung inputs about Samar. May isang city, may isang town. But we will not take it against the province. Wala pa silang province-wide holiday. Okay, next.
Yes, of all the four, like Samar, for example, they don't have a provincial working holiday. They only have two towns, as I mentioned earlier. La Union also does not have a provincial holiday.
Okay.
They only have one
Sino?
municipality. That's
Sino po? Which municipality?
Agoo.
Agoo. Sige po.
And then Marinduque, they have one. That's a battle of. They have two. Battle of Pulang Lupa and Battle of Paye. So they have two.
Province-wide po yun.
Province-wide special non-working holiday.
Oo.
And the only province that does not have any local and the provincial holiday is Bukidnon, Your Honor.
Okay, so I think it's the position of the minority will be obvious with the three provinces na wala pa na province-wide holidays kasi kahit meron sa local, I mean, Agoo kasi mga historic towns yan, naunahan naman talaga. So okay na yun po. I mean, let it benefit Agoo, but the province, and then si La Union, sa mata ni La Union yung si Isabela, si Ilocos Sur, meron na. Ganun ba? O si La Union, wala sa province-wide.
La Union,
Oh.
that's the tab.
But yung isa, Mr. President, overkill naman siguro. Kung
Yung Marinduque has two special.
tatlong holiday. So, ako, Mr. President, I keep an open mind to declare a special non-working holiday in the 3 provinces na wala pa, only because majority of provinces already enjoy at least one special non-working holiday. Bakit sila i-deprive natin?
So in the interest of parity, we shall, the chair subscribes to the magnanimous position of the minority leader. I presume that at the proper time, the needed and necessary amendments to any one or all of the 4 will be done by the sponsor during the period of amendments.
Yung isa po, so let's just medyo, what's the solution of the Senate President to declare it as just as a special day, which is
To declare it as a special day without prejudice to the President, so declaring it if he so desires.
and a special day is a regular working day.
Yes, it is not a holiday.
Mr. Sponsor,
Yes,
in the case of
That's
Marinduque.
very much welcome. That has
Okay.
been the policy, anyway, that we have been following.
And then siyempre, of course, we just want to know the reason bakit yun ang mga araw ang mga napili. Why is that day special for, why is August 11 special for Samar, for example?
Hindi ko alam paano ko naman malalaman yun.
Actually, nasa title na, Mr. President.
Yes, I have
The
here
reason
with
is,
me.
is already found in the title.
Yes, Your Honor,
Because-
Mr. President, I have with me here the rationale why they chose those dates. For Samar Foundation Day, August 11, Samar Day used to be celebrated every November 10 to commemorate the first local election in the newly created provinces of Samar. The island was divided into 3 provinces in 1965. The celebration of Samar Day was moved to August 11 in the late 1970s upon the recommendation of a committee tasked in finding the appropriate day.
So, this is the Samar na nasa west, no? Ito yung,
Yes.
sa tatlong Samar, ito
West.
yung pinakamalaki
West
na nasa
Samar.
west. Oh, nga, so it is not celebrating that original, the first date that you mentioned. It is not celebrating that as a holiday.
They used to celebrate it at November 10. Now they would want it at August 11.
Kaya nga, are we sure that November 10 will no longer be a special non-working holiday in Samar? Hindi na.
Yes, correct. That's
Klaruhin
correct.
lang po natin yun. Baka maging in addition
Maging
ito.
doble, hindi ba?
Hindi po, November 10, hindi na. August 11 na.
Yes, if I may continue, the provincial government of Samar showcased the Tandaya Festival 2023 in connection with the 183rd anniversary of Samar Day on August 11, 2024. The celebration was premised on the royal order from Queen Isabella II of Spain, dated August 11, 18 election in the province. Your
Yeah,
Honor.
when they say commemorate, nagsiselebrate sila. I mean,
Used to be. Kaya I think that there was a committee that was tasked to find out, as I mentioned.
Did that date used to be the holiday in Samar?
Yes, before that was what was considered as their provincial holiday, Your Honor. Foundation Day.
Kaya nga. I mean, when we pass this law, August 11 will be a special non-working day. How about November 10? Will it continue to be?
I don't think so because there was already a committee that was tasked to find out the appropriate day. So they moved it to November,
Yung legal
August 11.
basis. The legal basis for celebrating November 10 as a special non-working day in Samar, nandyan pa ba o wala na? Kasi kung nandyan pa, this will be a second holiday.
The matter can be addressed perhaps in the repealing clause. If there is a law.
Yeah, we're finding out, Mr. President. Wala legal basis. We're just making sure, Mr. President, na hindi tayo nagkamali na this will be the first special non-working day for that province.
There's no
Wala.
legal base for
Okay, so-
November 10, Your Honor.
Okay, so we are sure that this is the first. So I think we should grant it, Mr. President. Okay, now to the province of La Union, ano naman po yung kahalagahan ng March 2?
The local holiday, La Union Day, ito po yung request sila, no? That March to be declared as La Union Day. The local holiday commemorates the founding of the province of La Union, March 2, 1850. It was the 34th province to be created since the founding of Cebu in 1565.
Okay.
The people of La Union referred to March 2 as La Union Foundation Day, which they commemorate every year to celebrate the rich history, great achievements, and significant contributions of its people.
Okay, that's nice. How about sa Bukidnon? What's the importance of September 1? Kasi ang research namin, March 10, there's another date, March 10, 1917, that Bukidnon became a regular province through Act number 2711, Mr. President. So what is now the significance of September 1? So hindi sila nag-holiday sa March 10. Ang Bukidnon, sure kayo.
Ba't meron daw March?
Oo nga.
Bukidnon.
Hindi siya ba ito?
Bukidnon.
Hindi siya ba ito? Presidential proclamation.
Di ba
Bukidnon na po, Bukidnon na po. Yung La Union, hindi ganito po, no? Sa Samar, merong kasing another date na na-mention na may be
Correct, correct.
significant. Naklaro ng bill natin, pagdating sa Samar, ang napili din nila na gusto nilang i-celebrate is August 11. No problem.
correct.
Pagdating sa La Union, March 2 yung bill, historically, March 2 din ang
That's
importance. So there will be, I foresee no problem. Pagdating po sa Bukidnon na, hindi na La Union, Bukidnon, araw ng Bukidnon, meron, according to my staff, there is Act number 2711 that made Bukidnon a province, and this is dated March 10, 1917. And in 2008, there was even a presidential proclamation number 1461 which enabled the Bukidnon residents to celebrate their 91st founding anniversary. Ang date nito is March 10, ang sinelebrate, March 10. So, we are just making sure na talagang isa lang po ang holiday.
Pero ano yung nabanggit niya?
Ano ba itong founding anniversary? Ano naman ito? Ano ba may sanlo eh?
March 10. Wala pa tayo nun. Well, Your Honor, Mr. President, based on the House bill, they would want September 1 because the provincial Bukidnon commemorates its founding anniversary every 1st of September every year.
Okay.
Based on the Act number 2408, otherwise known as the Organic Act for the Department of Mindanao and Sulu, which took effect on September 1, 1914. This is based on the House bill, Your Honor.
Kaya nga, basta the people of Bukidnon, basta yun ang klaro, would rather celebrate their foundation anniversary on September 1. Abandoning, basta yun lang gusto ko sabihin, abandoning March 10. Baka naman magkaroon ng dalawang celebration po ito, Mr. President. Kaya natin ito in-entertain kasi nga, sabi natin, wala pa silang province-wide holiday.
Kaya inaano na kasi, mas significant to. Well, this is according to the House bill, Your Honor. So we just based our committee report on the House bill because of course they would want
Pero wala pa legal basis to celebrate March 10.
these are composed of 3 representatives, so we would just respect, no? Because yung kanila po ano sa local
Ito na po yung napili.
decision. Yung,
Hindi, pero ito yung... But this will be the legal basis now for celebrating a province-wide holiday on September 1. And there will be no other legal basis for to celebrate a province-wide holiday, non-working holiday on any other date. Yan lang naman importante. Wala na, di ba?
That's correct.
Okay, sige po. And sayang wala rito yung the most authoritative person who can tell us, Mr. President, our former Senate President. So with this, Mr. President, I think they are entitled to a special non-working holiday province-wide because we have established that for these 3 provinces, they have no existing legally declared province-wide special non-working holiday.
And just to clarify, for Marinduque, if I'm not mistaken, it will be a working
Yes.
special day
Yeah.
without prejudice, subject to the wording to the president proclaiming such a day to be a non-working holiday.
Yes, for the record, the three provinces na nakitaan natin na sabi natin na entitled would be Samar, La Union, and Bukidnon.
Thank you very much, Senator Pimentel. Senator, I will now refer to you as the majority leader again. Majority leader?
Mr. President, with no other individual, I move to close the period of interpellation, Your Honor, Mr. President. Mr. President.
Is there any objection? Chair is none. Motion is approved.
With the consent of the body, Mr. I move to open the period of individual amendments of House Bill number 3974 and recognize this representation.
Any objection? Hearing none. Same is approved.
I stand corrected, Mr. President. There's no more individual amendment. I move to close the period of amendments.
Any objection? Chair is none. The period for both committee and individual amendments is hereby closed.
With the consent of the body, I move that we approve on second reading House Bill number 3974. I so move, Mr. President.
Any objection? Hearing none. House Bill number 3974 is approved on second reading.
Mr. President, with the consent of the body, I move to open the period of amendments of House Bill number 3971.
Any objection? Hearing none. Same is approved.
With no committee or individual amendment, I move to close the period of amendments.
Any objection? Hearing none. Same is approved.
With the consent of the body, I move that we approve on second reading House Bill number 3971. I so move, Mr. President.
Any objection? Chair hears none. House Bill number 3971 is approved on second reading.
With the consent of the body, I move to open the period of amendments of House Bill number 5826. Mr. President, I
Any
so move, Mr.
objection? Hearing none. Same is approved.
With no individual or committee amendment, I move to close the period of amendments.
Any objection? The period for both committee and individual amendments is hereby closed.
With the consent of the body, I move that we approve on second reading House Bill number 5826. I so move, Mr. President.
Any objection? Hearing none. House Bill number 5826 is approved on second reading.
Non-working na. Non-working.
Majority Leader?
Yes, Mr. President, with the consent of the body, I move to open the period of amendments of House Bill number 3972. And I so move, Mr. President.
Any objection? Hearing none. House Bill number 3972, the period for amendment of House Bill number 3972 is hereby open.
With no individual or committee amendments, I move to close the period of amendment. Ay, I stand corrected, Mr. President. For a individual amendment, Mr. President, if I may.
The gentleman may proceed.
Yes, on page 191, after the word special, delete the word non-working and replace it with the word working.
Any objection? Hearing none, same is approved.
On page 193, after the word anniversary, insert a new last sentence to read as follows. Upon proclamation of the President, February 21 of every year shall be a special non-working holiday in the province of Marinduque.
Any objection? Hearing none, same is approved.
Close? Are you about to close?
One more.
One more.
One more. Sige, could you just finish with the
Lastly, amend the title to read as follows. An act declaring February 21 of every year as a special working holiday in the province of Marinduque to be known as Araw ng Marinduque in commemoration of its founding anniversary.
Any objection? Hearing none, same is approved. Minority Leader?
I'm just a bit worried about the terminology, Mr. President. Have we ever used special working day or holiday? Special?
Yes, I believe so. During the time of Senator Drilon, when I was the chair of the Committee on Higher Technical Vocational Education, and I was the one sponsoring the holiday bills.
Yes, okay. Anyway, hindi na natin ito i-approve ngayon eh. So, hindi natin i-approve on third reading
No,
ngayon,
we-
right?
we will
So, we can, maybe over the weekend, if we can be provided with the specific laws which use the terminology. Kasi ako, I would rather have used a special day. Kasi if we do not want to make it a non-working holiday, it's actually a regular day which we want to be treated as a special day because it commemorates something. So parang I do not parang there's no need to emphasize that it's a special working holiday. Yung pa may hinaluan pa natin kasi ng word na holiday. So
Mas special kasi, mas special pag...
well, that's
We
just
will furnish the gentleman with copies of similar laws, Your Honor.
Can we have an RA number now, an example, so we can take a look?
No, we will furnish it, again, without prejudice, because we can reconsider it anyway.
Sige, so we will allow the approval of the bills on second reading, Mr. President.
Thank you, Your Honor.
Thank you, our Minority Leader. Mr. President, with no other individual amendment, I move to close the period of amendments.
Is there any objection? Chair is none. Motion is approved.
With the consent of the body, I move that we approve on second reading House Bill number 3972. I so move, Mr. President.
Any objection? Chair hears none. House Bill number 3972 is approved on second reading. Majority Floor Leader.
Mr. President, I move that we dispense with the reading of the Journal of the 7th Session Tuesday, August 6, 2020, and consider the same as approved.
Is there any objection? Senator Pimentel is recognized.
Not the journals, Mr. President. Gawin natin yun sa Monday to Wednesday, maybe because some of our colleagues may have some issues with the journal. Hindi natin alam yun, hindi natin ma-predict yun eh.
Majority Leader.
Yes, Mr. President, I withdraw my earlier motion.
So withdrawn.
Mr. President, I move that we adjourn the session until 3 o'clock in the afternoon, Monday, August 12, 2024. I so move, Mr. President.
Any objection? Session is hereby adjourned until Monday, August 12 at 3 o'clock in the afternoon. Thank you.